This is basically a continuation of the tape you've just seen. In your particular instance, a total shoulder replacement, a conventional total shoulder replacement is not possible due to the nature of your shoulder problem. And what we'll be doing in your particular case to address your specific problem is called a reverse shoulder replacement or a reverse shoulder arthroplasty. What I'm going to do in this presentation is just explain to you what that is, what the prosthesis is. Everything you've already heard about the preoperative workup, the risks of the procedure for a total shoulder replacement, what transpires after the surgery, what transpires while in the hospital will still be true, and I won't repeat all that. So now I'm going to show you what this reverse shoulder replacement looks like and show you how it actually functions. As you saw with the first tape, you saw how the pieces from the conventional shoulder replacement went into the bone. This is called a reverse shoulder replacement. And the reason it's called a reverse shoulder replacement is there's still a ball and there's still a socket. However, the two pieces are in reverse order. The ball now goes on the socket side, and the socket now goes on the ball side. If that's not confusing, then hopefully as we talk here it will become less so. On the ball, on the side in the conventional replacement where the ball goes, this is on the arm or the humerus, there's still a stemmed piece that goes into the bone. This is the stemmed piece here. You can see it looks similar to the other prosthesis, but on the very end of this stem, you can see there is no ball. There's this kind of concaved structure here. It's circular and concave in its contours, and this actually will go into the humerus just like you saw on the first tape. And then what we place on the shoulder blade is this circular structure here. This is the ball, as you can see here. And this ball will articulate with that concave piece that goes into your arm or your shoulder, your upper humerus. And this is implanted into the native socket on the scapula right here. And now this concave piece that has now gone into the humerus will articulate with the rounded ball that goes into your shoulder blade, as you see here. And this creates a more constrained articulation that is actually intrinsically more stable than the conventional shoulder replacement that you saw in the first segment. The reason for this is this constraint is necessary because in your particular case you do not have a functional rotator cuff. And what we're depending on here to make this function properly is the strength and function of your deltoid muscle. In a normal shoulder, I'm going to switch models now. In a normal shoulder, what keeps, this is the conventional shoulder replacement now, what keeps this ball articulating with this very narrow socket is the rotator cuff structure. And the purpose of the rotator cuff is to stabilize this joint and prevent this ball from dislocating away from that socket. With the stability provided by a functional and normal rotator cuff, the other muscles around the shoulder, including the deltoid muscle, can now pull the arm up and prevent the ball from disconnecting from the socket. That's in a normal situation. Now in your situation, you do not have a functional rotator cuff. Therefore, that articulation in the normal situation is not going to be stable, and when you try to raise your arm up, the ball will disconnect or dislocate from the socket and the shoulder won't function properly. With this reverse design, because there's a concavity on one side and a ball on the other, it's more constrained, and it's the shape of the components themselves. And as you can see here, the shape of the socket, which is on the arm side, is considerably different than the shape of the socket in the conventional model. This is the socket in the conventional model, and this is the socket in the reverse model. And remember, the socket now is on the arm side, and you can see the difference in shape and dimension. This is a more round, has a greater concavity here, and just creates more stability for the joint. This will be captured on the ball, so when the other muscles around the shoulder contract, these pieces will not separate from each other, and they will not dislocate from each other. And this socket, which is on the arm side, can now rotate around the ball, and the deltoid muscle can actually pull the arm up without there being concern about these two pieces separating from each other or dislocating. So that's kind of a simplistic explanation of the concept behind how this reverse shoulder works. Now the general risks of the procedure are very similar to that for a conventional shoulder replacement. There are some additional concerns with the reverse shoulder because it's a different design and the way it's attached to the bone is somewhat different. The other types of things that one has to be concerned about when a reverse shoulder replacement is done is the rehab is somewhat different. It does require a longer reliance on your sling to allow for healing and stabilization of the scar that develops in the shoulder after the surgery. If the arm is not carefully positioned during the first 4 to 6 weeks following the surgery, there can be a risk of the prosthesis dislocating. Once you're beyond that 4 to 6 week period of time, that risk is significantly diminished. There can be concerns about the insertion of these pieces into the bone. Many times the individuals we're doing this on, this could include you yourself, have fragile bone, and the bone can be fractured during the insertion of the pieces, which can then create a more prolonged rehabilitation and a more uncertain outcome from the surgery. The risk of these types of mechanical issues developing during the course of the surgery itself is relatively small, but the risk of that happening is somewhat greater than it would be for a conventional shoulder replacement. Following the surgery, you would then stay in the hospital probably 1 night, at the most 2. You would have no need to go to a rehab facility unless in your particular circumstance one would be required. You would be kept in a sling following your discharge from the hospital, and depending on the procedure itself and any problems that may be encountered during the procedure, you may or may not require relying on that sling for up to 4 to 6 weeks following the surgery. In most instances, the sling is only necessary for comfort and can be discarded after the first week. We do expect you to start using your arm in most circumstances almost right away. Generally, we have you or most patients do their therapy with this procedure entirely on their own. In some circumstances, we will have you work with a physical therapist. That may or may not be necessary. The one further difference between the reverse shoulder and the conventional shoulder is we do require that you sleep with a sling with the reverse shoulder replacement. The sling is necessary at night when sleeping for at least 6 to 8 weeks. All the other risks of infection, stiffness, poor function, continuing pain after the surgery, these risks are probably no greater than they would be with the conventional shoulder replacement. And the risk of any one particular complication occurring is, again, very small.